Thank you for watching the video. When you catch a cold and have trouble breathing, wheezing, or when you cough a lot after being in a cold place or exercising, have you ever had such experiences? It could be asthma, or it might be another respiratory disease. So this time I'll talk about how to tell if you have bronchial asthma, diseases similar to bronchial asthma that require attention, and the characteristics of people whose asthma is hard to treat. By watching this video, people who are currently being treated for asthma can learn how to avoid the risk of their asthma getting worse in the future. Also, if you're wondering, could I have asthma, or maybe my child has asthma, this video will help you clearly understand the differences between asthma and other diseases. Please watch until the end. I also actually see patients with asthma or other diseases that cause a persistent cough, but many patients have trouble distinguishing between them. It's also difficult to explain in the short time we have during an outpatient visit which lifestyle habits make asthma worse and which habits help prevent it from getting worse. With that in mind, I made this video to give you a complete understanding of asthma, so if you're interested, please watch until the end. So in the first section, I'll explain what bronchial asthma actually is as a disease. Then in the second section, I'll talk about the differences between bronchial asthma and cough variant asthma, which is often mistaken for it. In the third section, I'll explain how bronchial asthma is treated and what you can do to recover from it. Finally, in the fourth section, I'll introduce 4 common characteristics of people whose bronchial asthma is difficult to cure. So first, let me briefly explain what asthma is. In the past, I was told that I have a tendency toward asthma. But what does a tendency toward asthma actually mean? I often get asked questions like this, or people say, I'm wheezing. This is asthma, right? When you're asked these kinds of questions, are you able to answer them? Now let's take a look at what kind of disease asthma is. Please look at this image. On the left side, you see a normal bronchus. The bronchus is the airway through which air passes. And on the right side, you see a bronchus affected by bronchial asthma, where the walls have thickened and mucus has stuck to them. It's obvious at a glance that the airway is narrower in bronchial asthma. Why does this happen? Bronchial asthma is actually said to be an allergy of the airway, the passage for air. Due to stimuli like allergies, inflammation occurs. The airway becomes narrow, causing symptoms like shortness of breath or phlegm production. This is bronchial asthma. Causes that worsen asthma include dust, cigarette smoke, cold weather, and even stress is said to make it worse. And it's very important to control this asthma. When there's a slight inflammation in the airway, in other words like a small fire or a smoldering flame in a house fire, if you don't control it properly at that stage, the inflammation will keep getting worse and eventually turn into a big fire. And the more these fires occur, the hotter the airways become, and they won't return to their original state, so it's important to prevent even small smoldering flames from happening in the first place. So then, what kind of symptoms can be considered typical of asthma in order to detect it early? Common symptoms of asthma include, one of the symptoms is coughing just from running around. This is called airway hyperresponsiveness, and it means that even a little bit of running can cause you to cough. In addition, people with asthma often have trouble breathing and cough at night or in the morning. This is because symptoms are more likely to appear during these times due to the balance of the autonomic nervous system. In addition, when there are allergens like dust mites or dust in the house, these symptoms are more likely to occur, so it's also thought that they tend to happen at night or in the morning. Also, if you wheeze or have a whistling cough every time you catch a cold, you might actually have developed asthma. And actually, bronchial asthma is classified into different types. You don't need to remember the details, but in fact, children under 3 years old are more likely to have asthma-like wheezing or a wheezy cough. This is called transient early wheezing, and in many cases, asthma-like symptoms that appear before the age of 3 often go away as the child grows. To show you the data, by the time children enter elementary school at age 6, about 1 in 2, 50%, have experienced asthma-like wheezing symptoms at least once. However, of those, only 5.8% are actually diagnosed with asthma in elementary school, and just 5.1% in junior high school. In other words, even if a child is told they have asthma-like symptoms or are suspected of having asthma by the first grade of elementary school, only about 5 or 6 out of 100 of those children will actually go on to develop asthma. Because of this, it's actually quite likely that as children, many were told they might have a tendency toward asthma. Up to this point, this has been a review of the first lesson. Bronchial asthma occurs when the airways are stimulated by things like allergies. I explained that it is a disease where inflammation occurs, the airways become narrowed, and various symptoms appear. And I also explained that in many cases, wheezing symptoms in childhood often improve over time. Now in the second lesson, we'll discuss the differences between asthma and cough variant asthma, which can be confusing. I will also clearly explain the differences between asthma and bronchitis. Have you all heard of cough variant asthma? Since it has the word asthma in it, how is it different from regular bronchial asthma? To put it simply, without worrying about misunderstandings, it's easy to remember cough variant asthma as being one step before bronchial asthma. What does one step before mean? It means it seems like bronchial asthma, but the wheezing, the whistling or rattling sounds, those kinds of cough variant asthma, doesn't cause labored breathing or wheezing, but involves a persistent cough that can make you feel short of breath. You tend to cough easily when you exercise. After catching a cold, the cough tends to linger. People like that may have cough variant asthma. In fact, it's said that about 30 to 40% of people with cough variant asthma eventually develop bronchial asthma, so you need to be careful. And there's another confusing condition called bronchitis. So what is bronchitis? When you catch a cold, you might get a sore throat or a runny nose. Basically, a cold is when a virus affects your upper respiratory tract. Bronchitis is when this virus affects the bronchi. It means the virus infects the airways. Since it's inflammation of the airways, the trachea becomes narrower, and you may start to hear wheezing sounds. I've been mentioning wheezing, and when you listen to the chest with a stethoscope, especially when exhaling, you can hear a distinctive low-pitched sound. This is called wheezing. Wheezing can also occur with bronchitis, so just because you hear wheezing when you catch a cold, it doesn't necessarily mean it's bronchial asthma, so please be careful about that. Now let's review the second period. The difference between bronchial asthma, cough variant asthma, and bronchitis is that cough variant asthma is one step before bronchial asthma, and at this stage there is no wheezing yet. I mentioned that it might possibly progress to bronchial asthma, and bronchitis is completely different. It happens when a virus, which is the cause of a cold, affects the bronchi, causing the bronchi to narrow and resulting in wheezing. These are temporary symptoms. In other words, with bronchitis, you will recover completely after a while, which is the difference from bronchial asthma. How was that? Now, in the third session, I will explain what kind of treatments are actually used for bronchial asthma and what you should keep in mind to make it easier to recover from asthma. You probably imagine using inhalers when treating bronchial asthma, but what is the actual goal of asthma treatment? Is the goal to reduce hospitalizations caused by worsening bronchial asthma? Actually, that's not the correct answer. What is the ultimate goal of treating bronchial asthma? The ultimate goal of bronchial asthma treatment is to prevent exacerbations and inflammation in the bronchi and to suppress airway remodeling. Remodeling might sound like a sudden and unfamiliar term in katakana, but don't worry. As I mentioned at the beginning, it means that inflammation keeps occurring in the airway walls, making them thicker and narrowing the passage for air. This is what we call remodeling. When remodeling happens, inflammation can occur more easily, even with minor triggers. This is called hypersensitivity, and when hypersensitivity increases, or when the airway is already narrow, even a slight worsening can lead to severe symptoms that may require hospitalization. So it's not enough to just use an inhaler and think it's okay if a mild attack goes away quickly. We need to reduce the number of attacks themselves, or you might have difficulties in your future life. Please remember that the main goal of asthma treatment is to control this inflammation. This is very important, so I'll keep repeating it. The symptoms of bronchial asthma are just the tip of the iceberg. The cough and wheezing and the difficulty breathing you experience at the surface. Behind those symptoms, there are various mechanisms at work, and these are causing remodeling. If you follow them from the top down, symptoms appear. The reason is that the airways are narrowing. The cause of the narrowing is that the bronchi have become more sensitive and their hypersensitivity has increased. So, why have they become more sensitive? The cause is inflammation. And what causes that inflammation? There are various reasons, such as allergies, stress, and the environment. Suppressing the inflammation behind these invisible symptoms also helps prevent remodeling, so it's not enough to just use an inhaler when your symptoms get worse. It's important to use your inhaler regularly, even if you don't have symptoms, in order to reduce the inflammation itself. There are two main types of treatment for bronchial asthma: controllers and relievers. The terms controller and reliever might sound confusing, but to put it simply, a controller is something that controls the condition. In other words, it's the medication you take every day. Even if you don't have symptoms, you take allergy medicine daily, or you might use an inhaled steroid to suppress inflammation. And a reliever is the medicine you use when you suddenly have trouble breathing, to open up your narrowed airways. When you're struggling, you use it and it makes breathing easier. That's thanks to the reliever, but as you can imagine, the reliever only opens up your airways. It doesn't actually suppress the inflammation. It's the controller that fundamentally suppresses the inflammation, so it's important to use both of these properly. For adults, most inhalers are the type where you click and inhale the powder, but for children, since they sometimes can't inhale properly, we may have them take the inhaler home and use it there. That's what we do. And the tricky thing about asthma medication is that with these controllers, it's important to use them every day, even when you don't have symptoms. But as the saying goes, once the danger passes, people tend to forget about it. There are many people whose bronchial asthma tends to get worse because they have trouble using the inhaler when they don't have any symptoms. On the other hand, with this reliever, using it when you're having trouble breathing brings relief. So when it comes to the reliever, people often ask for a new prescription as soon as they run out. There are many people who come to the hospital for this, and whether their bronchial asthma is well controlled or not, there are various ways to assess that. This green sheet here is called JPAC, and even children can mark circles on it to score their asthma control, making it easy to understand. How many times did you wheeze in a month, or how many times did you wake up at night because it was hard to breathe? It's an evaluation method where you answer those kinds of questions. In addition, there is also something called a peak flow meter. When you have asthma, your airways become narrower, so sometimes you can't blow out air forcefully. By using a peak flow meter every day, you can measure how fast you can blow out air. This device helps you feel the condition of your own bronchial tubes. Very young children may have trouble using it properly, so it's usually for kids who are a little older. It's often used with children. By actually blowing into it, they can evaluate their own bodies themselves, which is a unique feature of this assessment method. This is a review of the third period. What kind of treatments are actually used for bronchial asthma? We talked about controllers and relievers, and I mentioned that the treatment goal is important. The goal is to suppress inflammation so that not even minor attacks occur, so it's important to use controllers properly. Now finally, in the fourth period, I will introduce 4 characteristics of people whose asthma does not improve. Even though they are using inhalers properly, they keep having attacks. Such people they may fall into one of these 4 categories. Here is the first of the 4 characteristics of people whose asthma does not improve: not taking measures against dust mites. It is said that 80 to 90% of people with childhood asthma have allergies. Among those allergies, dust mite allergy is especially common. There are even reports that people with bronchial asthma have fewer attacks just by cleaning their rooms and reducing dust mites. Therefore, it is important to take proper measures against dust mites. For example, cleaning your bedding, switching to anti-mite sheets that make it harder for mites to stick, and in the case of children, occasionally washing their favorite stuffed animals. You can also make sure not to bring stuffed animals into bed at night, or lower the humidity by opening windows when it's high to prevent dust mites from increasing. These kinds of measures are important. The second characteristic of people whose asthma doesn't get better is this: being exposed to cigarette smoke. Of course, people who smoke will see their asthma get worse, but even secondhand smoke can make asthma worse. In the first place, secondhand smoke causes inflammation in the airways and gradually reduces lung function. Not only that, but inflammation can also occur in the bronchi, which can make asthma worse. Furthermore, there are even reports that inhaling cigarette smoke can reduce the effectiveness of the inhalers you use regularly. So, if you have a family member who smokes and it's causing problems, try to have them change where they smoke, or when you go to restaurants or crowded places, choose places with separate smoking areas. It's important to be conscious of choosing environments that won't make your asthma worse. Here is the third characteristic of people whose asthma doesn't improve. It's people who don't get enough exercise. Actually, many people with asthma think they shouldn't exercise because it can make them cough more easily. But that's actually the opposite. By exercising, there are also reports that asthma control improves. However, on the other hand, there is also something called exercise-induced asthma, and exercising can sometimes make asthma worse, so it's important to do a proper warm-up. Cold environments are also not good, so please avoid exercising outdoors when it's cold and try to exercise indoors instead. Make sure to do a proper warm-up. For example, do about 20 minutes of exercise that gets you a little out of breath to warm up your body before moving on to the main exercise. If you take these kinds of precautions, it's actually said that exercising can help improve asthma, so please keep this in mind. Here is the fourth characteristic of people whose asthma doesn't get better: measures against hay fever. Some of you might be wondering if hay fever and asthma are related. I mentioned that allergies are involved in asthma, right? Hay fever is also an allergy. It's said that if someone with asthma also has hay fever, when their hay fever gets worse, their asthma tends to get worse too. So, taking proper measures against pollen is also important. It may help improve your asthma. The basics of pollen prevention are not to inhale it and not to bring it inside. First, to avoid inhaling it, please make sure to take measures like wearing goggles or a mask. And something that's often forgotten is not to bring pollen inside. If you hang your clothes outside, pollen can stick to them, and bringing them inside will spread pollen throughout your room. Also, depending on the type of fabric, pollen can stick more easily and be harder to remove. There are some materials like this, so by choosing clothes made from smooth fabrics like silk, it's harder for pollen to stick. Also, the main causes of hay fever are things like dust mites and cedar pollen. Recently, there's a treatment called sublingual immunotherapy, where the allergens from cedar or dust mites are placed under the tongue. By administering these substances, it affects the immune system and helps overcome allergies to dust mites and cedar pollen. You have to take the medicine once a day for 3 to 5 years, so it's pretty tough, but people close to me who have undergone this treatment and suffered a lot. There are many people who say their hay fever has improved significantly, so I recommend consulting a nearby allergy specialist. Please consider visiting a clinic as well. How was it? In the fourth session, I introduced 4 characteristics of people whose asthma is difficult to cure. First, measures against dust mites. Second, avoiding passive smoking. Third, exercising in an appropriate way. And fourth, taking measures against hay fever. How was it? This time I talked about ways to improve asthma symptoms. I explained in an easy to understand way how to distinguish whether these symptoms are asthma or something else. As a doctor, I share information that can help you become healthier starting tomorrow, so I hope you'll continue to watch my videos. Well then, see you in the next video. My book, How Not to Age After Your 70s, which I learned from my patients as a general practitioner, became a bestseller in 4 categories on Amazon and ranked #1 in the gift rankings. I compiled into one book the important ways of living and health methods that I learned from my patients while working as a doctor. I also want to live a healthy life like this. This book will make you feel the same way. It's on sale now with great reviews, so check it out.